public have not been wearing masks while on the shorelines of the nation's beaches. Example, Maracas Bay. The population is strongly urged to comply with the public health guidelines in this regard. The government of Trinidad and Tobago is seeking to ensure that we do not erode recent gains in the management of the COVID-19 pandemic and that the health and safety of the population is maintained. Thus, we are depending on the cooperation of the public so that this recent relaxation in public health measures will not have to be reconsidered and that beaches can remain open for everyone's benefit. We urge the population, please, to comply. And so we go to the clinical update from Dr. Hines, please.
Thank you, Ms. Alcantara. Good morning. Good morning to Dr. Doon, to Mr. Sharma, to members of the media and members of the viewing and listening public. The clinical update for today reflects the data as at November 10th at 4 p.m. As at that date and time, we had tested 34,248 unique individuals. Of those, 5,880 have tested positive. You will note a 31 case increase in the total number of new positives reported in that time frame. We have had 111 deaths, and we extend our condolences to the members of the bereaved families. At present, there are 31 patients in hospitals. There are 30 in step-down facilities. There are 439 individuals in home self-isolation and 166 individuals in state quarantine facilities. We've had 5,238 recoveries, and at present, the total active patient caseload remains at 531. That brief summary brings me to the end of the clinical update.
Thank you very much, Dr. Hines. As you know, one of the categories of persons that are at the highest risk for serious COVID-19 complications are persons with diabetes. In light of World Diabetes Day this weekend and this fact, Dr. Doon will present on diabetes and its relation to COVID-19.
Good morning. Thank you, Candace. Good morning to all looking at our presser this morning. I'm going to talk a little bit during my presentation on the public health approach to managing diabetes in this country in general. And you may wish to ask me what do we mean by the public health approach? Well, public health, a simple definition, is what we as a society do to assure the conditions for our population to be healthy. So therefore, it's the same approach that's been established to deal with the COVID epidemic, where it's a whole of government, whole of society, public, private sector, all and the population, all working together with one objective, one goal. And seeing that diabetes is a precursor to serious condition when you have COVID, serious complications, it is perhaps useful to bring to highlight diabetes and the status of diabetes in the country and the magnitude of the problem. Because it's a huge problem in Trinidad and Tobago. The prevalence today is about 22% of the population in the country. 90% occurring in people having type 2 diabetes, and 20 to 22% would give us about over 200,000 people. So it's a large number of folks in our country that have this condition. Now, you may very well wonder, was it this way all along over the years? In the 60s, the prevalence of diabetes in this country was 3.4%. It's a vast difference, although 6 times is less. And when we travel up to the 80s, 20 years later, the prevalence was 10%. And today, 40 years later, it's 22%. So that's the prevalence of the disease. What about mortality of the disease? And a little bit of history too. In the 60s, it was the 7th leading cause of death. So diabetes was pretty rare in the 60s, you know. Growing up then, you never heard about diabetes. You probably heard about every other thing else, strokes and so on. And you wouldn't hear about diabetes. Communicable diseases like COVID and all the other stuff, measles, etc., malaria, they were much more common than these chronic diseases. So it was the 7th leading cause of death. And today, diabetes is the 2nd leading cause of death. So you will see what the situation. So we have much more risk with COVID being multiplied, simply having COVID. And as the population age and you grow older, the presence of chronic diseases, and we're speaking about diabetes today. So diabetes, 2nd leading cause of death, accounting for 17% of total all-cause mortality, all causes. Now, of course, the other comorbid conditions are heart disease. Diabetes also as a risk factor for heart disease. So we have to speak, we can't only speak about diabetes alone as a risk factor. So heart disease is the #1 cause of death, and hypertension, etc. So what are the factors that influence this epidemic that we have? And we'll refer to this as an epidemic also. Epidemics, we do have epidemics in chronic disease, not only infectious diseases. And everyone knows what are the risk factors. We've been speaking about it multiple times over time: unhealthy diets, sedentary lifestyle, high levels of inactivity, alcohol, and tobacco. So in other words, just like infectious diseases, I like to think of diabetes as a hand-to-mouth disease because of the very nature of the behavioral risk factors. So over time, we grew up in the 60s in environment of a dietary environment of local fruits and vegetables, starchy roots, particularly blue food. We all understand the healthiest of all starches. And we moved towards an energy-dense diet high in processed foods and beverages, animal source food, added sugars, fats, and salt. So you see, we've changed the way we live, and we have now been operating in an obesogenic environment because some of the biological risk factors, and by the way, it's a serious risk factor for COVID and its complication is overweight and obesity. They share similar risk factors. So diabetes, also overweight and obesity, is a serious risk factor, very, very important risk factor, and which is driven really by the obesogenic environment, the unhealthy diets and habits and behaviors, and high cholesterol and high blood pressure. Those are some of the risk factors there. So that the biological risk factors we are concerned with is the elevation of blood glucose, which is the centerpiece of diabetes, and its complications, and the overweight in the society. Now, overweight in the society has reflected the same transition as the prevalence of diabetes over time. In 2000, overweight and obesity in our school children, because school children are our most important, precious resource, and we are focusing on them to address these conditions. It was 11%. 11 years later, 2011, it grew to 23% overweight and obesity. And today, it's in the region of about 50%. So here we go. That's the transition. And that's the issue of, and of course, increasing aging of the population, and we are getting older and living longer. So the population over 60 years of age in this country is about 15%, accounts for 15% of the total population, which is more than 1,500, closer to 200,000 people. So we have in our planning, And again, with COVID, age is a risk factor, as you've heard Dr. I.A.N mention quite often. So you have aging population, and you've got diabetes, affected with diabetes, and well, we dealt with hypertension recently. But diabetes, so you see, we are compounding and maximizing the risks. And it's important as we deal with COVID to always remember the attendant risks that are very prevalent in the society, 22%. So they are at high risk for the complications of COVID and so on. So here we have a transition of the population has already taken place. We have a transition of the way we behave, the risk factors which are so common in the society. We have a transition in the obesogenic environment that we operate in, and the transition now into obesity and overweight occurs in 55% of the general population, the adult population. So we do have a serious problem. So that problem not only is central to the health sector and well-being of the population, and health and well-being of the population, but also it affects seriously the economic burden that the country has to bear. And just to give you an example, annually, the cost of addressing diabetes is about 3.5 billion TT dollars, with 35% being direct costs and 65% indirect costs. Indirect meaning complications and dealing with loss of work and loss of earnings and so on, and social services that must be kicked in. So we do have a huge health burden or disease burden, and coupled with the economic burden, and on top of that we have a pandemic. Well, that's a perfect storm. If I ever could think of about a perfect storm in healthcare. So it's a huge burden in healthcare that the country is facing at the moment, trying to manage all these things together. And like as the people say, old people say, it's like riding your bicycle and fixing it at the same time. It's like, this is a serious thing. That's why I'm saying that it's an all of government, all of society approach, because we need each other more than ever. At any other time in our history, I think that we need each other more than ever to be in harmony and be kinder to each other and compassionate to each other, and be much more understanding as we address this collectively as a nation and survive. Now, what's the goal when we deal with diabetes, particularly? In general, is to reduce preventable mortality by about 25%. 20 to 25% in the next 5 years. The strategies, quickly I'll go through, is risk factor reduction. Again, we mentioned increase in exercise, decrease in alcohol, tobacco, decrease in obesity, high blood pressure, and so on. And we've identified childhood obesity and primary health care, strengthened primary health care, as one of the major response by the public health sector to invest and address the epidemic. And of course, surveillance, research, and policy and planning, etc. So there is an approach that we have adopted with dealing with diabetes, which we refer to as the life course approach for diabetes prevention and control. And it embraces and also a settings approach, married with a settings approach, but essentially looking at the different stages of life where diabetes poses risks to the different sets of populations. So we will start with initially, you may well wonder, what does pregnancy has to do with managing diabetes and preventing and controlling diabetes. But in this country, we've estimated that there are about 20,000 pregnancies annually, and there are about 4,000 pregnancies which are at risk to developing diabetes in pregnancy. So what does diabetes in pregnancy account for? Well, diabetes in pregnancy is known to affect both mother and child. And the child may develop birth defects, they have difficulty in labor, and diabetes also causes large babies to develop in the mother's womb, unduly larger than normal, and therefore you'll have difficulty in delivery, etc. In later life, if this is not diagnosed and managed properly, the mother is at risk of developing permanently type 2 diabetes, and the child also is at risk of becoming overweight and obese, and earlier onset of diabetes, type 2 diabetes, will occur and are occurring in children in their early teens. So those are the conditions in pregnancy. So we have to look at pregnancy and manage diabetes in pregnancy as a first state order of business. The second stage, as I've mentioned before, is the looking at childhood obesity prevention and control. And we've made some interventions over time at banning sugar-sweetened beverages in schools, increasing activity levels and training and developing physical activity curriculum in schools to help our children to reduce and control obesity, and therefore the increase in the rise in diabetes. In the adult sector, we have been working in strengthening the primary healthcare networks. Primary healthcare networks to address it by also strengthening the response by the health sector in terms of increased testing and so on. Finally, we have identified self-management and personal responsibility to a key mechanism for addressing this burgeoning and rising epidemic in the diabetes scenario. So healthy lifestyle counseling is an important part of the self-management and self-responsibility activities, and testing and knowing your numbers. So the health sector is launching this program to assist and enable the population to get more information, be trained on how to manage yourself at home and how to know your numbers, and also how to mention your numbers. So in closing, one of the major things I'll have to broadly wrap up by saying we are going to emphasize health promotion, strengthening primary health care, prevention and early detection and control, self-management, and personal responsibility. And remember, abdominal obesity fuels the diabetes, heart disease, hypertension, and cancer epidemic in the country. And let me share with you an old Calypsonian from yesteryear who said, you may be old in your face, but you must be young in your waist. Thank you.
Thank you so much, Dr. Doon. And you know that we mention quite often that persons with comorbidities are at the highest risk of having serious complications as it relates to COVID-19. Previously, Dr. Doon spoke about hypertension, and today we got some more information about diabetes management. And we go now to Mr. Sharma, a colleague of mine, an epidemiologist and also a pundit. We know that many of us are looking forward to Diwali celebrations this weekend, and Mr. Sharma will give some advice on how to celebrate Diwali safely this year.
Thank you, Ms. Alcantara. Good morning to Dr. Doon, Dr. Hines, and other colleagues. And good morning and Sitaram to all citizens. What can we do to make Diwali celebrations 2020 safer during this COVID-19 pandemic? Diwali is one of the most auspicious times of the year for Hindus, and by extension for the national community. This year, Diwali will be celebrated on Saturday, the 14th of November. It is a time to celebrate, to express the joy of living, to forgive and to forget, to give gratitude and to prepare our homes and surroundings to receive the Goddess of Light, Mother Lakshmi. It is additionally a festival of sharing, bonding, reflecting on our value systems, our civil role and responsibility, and our principles. Splurging, celebration, and socializing are defining hallmarks of Diwali. And whilst this may be so, It is imperative that we remind ourselves of the guidelines that we at the Ministry of Health have been discussing with citizens over the past 8 months. Be reminded that COVID-19 is still very much with us, and we should maintain our attempts to reduce risk and transmission during Diwali celebrations. Across the globe, in India, the UK, USA, Canada, and many other nations, activities associated with Diwali have been curtailed, as Hindus at this time are making many sacrifices and taking personal and collective responsibility in the interest of their health and welfare. In the run-up to this much anticipated day, be reminded of the following. Decrease your time shopping at the clothing stores, sweets and food shops, etc., especially in busy indoor centers. This time around, avoid shopping right before the festival, as stores are likely to be very crowded. Be vigilant, exercise masking, cough and sneeze etiquette, and hand sanitization. If you have hired help at your homes to do chores, etc., yard cleaning, painting, ensure that both you and your assistants are masked and practice social distancing. Clean your home at the start and end of each day, as is necessary. Door handles, light switches, work surfaces, remote controls, devices, including phones. If you choose to have limited guests at your home, pay attention to tables, chairs, and other services intended for your guests. Ordinary cleaning products will work well: soap, dishwashing liquid, bleach, etc. While the pandemic can change a lot of things, and it has, we must not let it change our spirit. We will still celebrate Diwali and have fun with reduced risk. Here are some low-risk activities that you can undertake. Avoid large gatherings. Whilst it is traditional to invite or be invited by family and friends, or even the occasional dropping at homes in the neighborhood, be mindful, be cognizant, and avoid such gatherings with persons coming from outside your household especially, as this can greatly increase risk of contracting or spreading COVID-19. Keep in mind that you are especially urged to continue to isolate yourself from others if you are showing any signs and symptoms associated with COVID-19, persistent cough, fever, loss of taste and smell. Stay home and isolate. If you have tested positive for COVID-19 and you are still awaiting a test result, stay home and isolate. If you have not fully recovered or cleared the criteria for being around others, or if you may have been recently exposed to COVID-19, stay home and isolate. Do not host or invite anyone to your home if this be the case, and do not go to a home if you are invited. Follow the new normal and do your Diwali pujas, worship, and fellowship online with your pundits, extended family and friends via video calls, etc. Have virtual dinner with your friends and family. You can deliver the traditional festive meals and sweets to close family and friends, observing all food hygiene and hand hygiene practices and ensuring zero contact. Follow the new normal and avoid meeting people physically, hugging, kissing, shaking hands. Do your greeting with clasp hands, and as Hindus we are accustomed saying Sitaram and Namaste. Certainly you can do that. This is our custom as well. And even the now popular elbow greeting can be used. Respiratory etiquette is critical. Covering one's mouth and nose while coughing, sneezing. Use a tissue, handkerchief, or the flexed elbow and dispose of as appropriately. Refrain from hand sanitizers, which are alcohol-based, before lighting diyas, candles, fireworks, etc. These are inflammable and can cause fire hazards or burns to your hands. Rather, wash your hands instead of using hand sanitizers just prior to these activities with soap and water. And additionally, keep all alcohol-based hand sanitizers away from open flames as they may catch fire. The Honorable Minister of Health has already met with officials of some of the Hindu organizations, and they understand and they endorse the need to continue adhering to our guidelines and physical and social distancing at this time. Let us now step up to the table and do our part. As I close, I wish all members of the Hindu community, Trinidad and Tobago at large, a safe, holy, and happy Diwali. Shubh Diwali. Thank you very much.
Thank you very much, Mr. Sharma, for those very important guidelines at this point in time. And we go to the question and answer segment now. I invite media representatives to indicate your name and the name of the media house that you represent before posing, please, no more than 2 brief questions. And we begin with Express newspaper this morning, please.
Good morning, Kimbodra from the Express. Maybe Dr. Hines would want to take these questions. Dr. Hines, in a very simplistic way, I think a big question for a lot of people is, when does Trinidad and Tobago start getting access to a vaccine if it is starting to show itself as successful? That is, all things considered, that it's very early. You did speak about that on Monday. And I guess in there, if you could tell us or remind us what needs to be put in place for a country like ours to be in line to access something like that vaccine from the various avenues internationally. I hope that was clear. Also, when it comes to compliance among small businesses, for instance, I could speak about downtown Port of Spain, but it's happening around. We're seeing some slacking off, and it's happening in some critical places, such as fast food places. For instance, there's one place where the door is no longer being manned properly. So you're having customers coming. It's a very busy place. Customers coming in, they're not sanitizing, washing their hands. Also, the condiments are now in a common area for common use, large dispensers. So that sort of thing. So my question is, how is the Ministry of Health continuing to ensure compliance among these types of establishments? What are the resources that you would have to use? Thanks.
Okay, thank you for the questions. With respect to the first question, the mechanisms for access to the vaccine, whichever vaccine becomes available, have already been outlined a few times by the Honourable Minister. He has indicated that we are part of a facility called the COVAX facility, which gives us a seat at the table, access to vaccines that are being developed within a group of companies that are currently engaging in the vaccine trials and are looking at the results even as we speak. If we needed to access a vaccine outside of that, again, the appropriate mechanisms through the appropriate international and regional public health agencies will be followed in order to grant safe and equitable access. We can't say when the vaccine will be available to Trinidad at this point in time, as there has not yet been a fully approved vaccination one that has come all the way through all the various stages of approval and is ready for global distribution. So we can't put a timeline on something that hasn't reached the stage where distribution is the next step. So I can't give you a when, but I believe we have given you the how. With respect to the issue of various places, not just businesses, but places and people at the end of it beginning to slack off, I do feel that it's really important. You've raised an important point. We as a nation, we as individuals, each need to recognize that this is not the time for slacking. This is, in fact, the time for even greater adherence to all the public health recommendations, for the simple reason that this is the time at which we have begun to increase movement, increase interaction, and therefore we've begun to increase some level of risk. Now, one of the downsides of public health interventions is that when we see them working, we seem to feel that it's time to stop them. If we see public health interventions working, it means we need to continue what we are doing. Now, the Ministry of Health does have, through its Public Health Inspectorate, the ability to look at, to review the behaviors and the situations in business places, etc. And we will continue to be mindful of that responsibility as time goes forward. If there are areas of concern that can be shared with the ministry via the via the unit, the communications unit, we will be able to focus some of that capacity accordingly. We do not necessarily have eyes everywhere, but we do have a review program. We do have a mechanism at each county for reviewing business places, etc., that exist and operate within the bounds of each county. So if there's additional concern, something that we want to raise or flag, feel free to indicate that through the mechanisms at the communications department, and we will be able to look into it further.
Thank you very much, Dr. Hines. We go now to 98.1, please.
A very good morning to you, Ms. Alcantara, and to the panel, Stephen Cummings, 98.1 FM. I have two questions, which I will pose to Dr. Hines. Dr. Hines, over the last 72 hours, there has been 72 hours or so, there's been heightened optimism in parts of the global scientific community. Talk about a promising COVID-19 vaccine, which has shown, we have been told, having a 90% efficacy rate from percentage trials. Do you share, the same level of optimism? And the second question, in a broad general sense, we continue to see some encouraging trends when we look at our present caseload of daily infections and even deaths that remained at 111, as was reported in the last two of your 4 p.m. clinical updates. And as a follow-on, how would you grade the general population's response in terms of behavior and response to the virus out of, let's say, 100? What would your percentage grading be for the population at this time, if you have to give a grade? Thank you.
Okay, thank you for your question, Mr. Cummings. I believe you may have been absent at the Monday's press conference where we spoke in some detail about that new vaccine that had been reported as having a 90% efficacy. We did indicate that the interest and the excitement of the scientific world was shared by the ministry, but we do still advise that it's very early in the process, and it's early in the process for a number of reasons, including a small number of outcomes that were being compared for that efficacy. It's a short time frame, and there was more that would need to be done over another 2 weeks perhaps before we could look at taking that information further to regulators. The storage conditions, etc., that were necessary for keeping this vaccine were a little different from the routine storage conditions, this one requiring minus 80 degrees Celsius refrigeration. And overall, because it's still quite early, this would not be a vaccine that would become immediately available in any sort of very proximate time frame. So we are curious, we are excited, we are interested, but it doesn't change too much of what we're doing right now, as it's still very early in the process of this vaccine's outcomes being reviewed. Now, I would not use a percentage to gauge the response of, or to grade the response of the population to the regulations and the recommendations. What we would use is the actual changes in numbers of new cases as the population spreads or does not spread respiratory illness, including COVID-19. So the best gauge, not using a percentage grading, but using live data, so to speak, would be what sort of caseloads we're seeing on a daily basis, what sort of numbers of new cases. If we start seeing new cases going up, we know that there's something that's not happening in the population that should be with respect to risk reduction. If we see the number of new cases remaining steady or going down, then we say we're holding the fort with respect to the recommendations, and we want to encourage that. So a percentage isn't perhaps the most useful thing. Most useful outcome is the actual numbers of new cases, and we want to encourage everyone to continue following the public health recommendations. As I said, we know that when the public health recommendations seem to work, we want to bring them to an end. And that's usually premature, and it usually leads to exactly what we don't want, which is a resurgence in whichever public health problem we're trying to reduce. So grading, I'd say right now we're on an even keel, and we want to maintain either the even keel or increased reduction in cases. So we want to ask people to continue or strengthen what they're doing with respect to the public health measures, the hand sanitization, the physical distancing, avoiding going into crowded places if you are unwell, avoiding going to work if you're unwell, going to seek medical care if you start to feel symptoms of severe illness, reaching out to your CMOH as needed, going for a test. All of these things are things that are going to help us to maintain that even keel and continue to drive the rates of spread downwards.
Thank you very much, Dr. Hines. We go now to TTT, please.
Good morning, everyone. Crystal Wilson, TTT Limited. Two quick questions, and I'm uncertain whether or not there has been an update, and if there has been, please pardon my ignorance. Has there been any update on the passenger who recently passed away on the Caribbean Airlines repatriation flight? Has his body been returned to his family here in Trinidad? And to Dr. Hines, a large percentage of COVID-19 related deaths here in Trinidad seem to have been persons who would have had underlying health conditions. Are you in a position to say whether or not persons with diabetic conditions make up the largest number of those deaths so far? Thank you.
Okay, thank you for your two questions. The process for returning a body to the country of Trinidad and Tobago is one that follows some specific steps. The family will have to actually request through the office of the CMO that clearance to have repatriation of a body, repatriation of what we call human remains. That request would be sent to the office of the CMO, and that would initiate the process of bringing the body back home. To date, as far as I'm aware, no such request has reached the desk of the CMO, so that process is in whichever stage it may happen to be within the family, and when that reaches the desk of the CMO, we'll be able to facilitate as needed. Now, I want to perhaps manage both some concerns and some expectations around this story of the passenger having passed. One of the things that we want to emphasize and to get everyone to understand is that the current public health measures being taken for all the repatriation flights being carried out with all the individuals deplaning, coming off of a plane, are those designed to prevent almost absolutely the risk of any importation of COVID-19 in particular, and by the nature of the mechanisms and steps being taken, we also prevent the potential spread of most communicable diseases. The case of an individual dying on a plane, therefore, doesn't add or present any additional risk to the population at this point in time. If information becomes available that indicates that there may be additional risk to the passengers who were on the plane, they will be notified. The follow-up mechanisms for further intervention with each of the passengers would involve the county medical officers of health for the places where they live, getting in touch with them for additional follow-up, and if need be, then that will happen in accordance with whatever the Ministry of Health is informed would have been the official cause of death. That is information we do not have at this point in time, but as it becomes available, the necessary steps will be taken. What we also want to emphasize is that when that becomes available to the ministry and when those steps are taken, that's as much information as we will be able to disclose. There will be no point at which the actual cause of death will be able to be disclosed, so I'd want to preempt questions on that from the get-go. We will take all the public health measures necessary, and most of the public health measures already taken have reduced risk to the population. So thank you for that. The second question, can you just remind me what that was?
My second question had to do with persons and comorbidities or COVID-19 related deaths here, and I was asking whether or not persons with diabetic conditions perhaps make up the largest number of the deaths we've had so far?
Okay, thank you. Now, diabetes and hypertension being the most common comorbidities that we have in the population would almost automatically indicate that the proportion of those who have passed on with COVID-19 and those particular comorbidities would be higher than any of the other more uncommon comorbidities. You had a range, combinations of diabetes and hypertension, kidney disease, pre-existing malignant disease, but yes, diabetes and hypertension together have been the most common, the most frequent, and it reflects basically the status of the population as a whole, where those are the most frequent comorbidities that we have in the population.
Thank you very much. And we go now to CNC3, please.
Hi, morning everyone. Rashad Khan, Guardian Media Limited. Okay, so Dr. Hines, over the past 3 weeks or so, we would have seen some loosening of restrictions and increased movement. So has your contact tracing exercises at the Ministry of Health detected as yet anyone, no matter how small the percentages may be, anyone who may have seemingly contracted the virus from probably going to the beaches or going to the gym or any of those things that were recently reopened?
Okay, thank you for the question. Now, the recency of the reopening, as we really only reopened over the couple of weeks, we have 3 weeks now, that means that any cases that may have arisen since that time frame would now be coming to the fore at this point in time. The contact tracing activities as they currently being carried out have indicated something quite important that we would like to emphasize, and that is that the mixing of households, people going from one household to another, even for small gatherings, has been one of the recurring features that has been reported when the question is asked where you've been, who you've interacted with over the previous 14 days. That moving around, as much as we'd like to do it, we still want to encourage extreme caution and, in fact, to discourage unnecessary moving and mixing between households, as that is one of the things fueling the current numbers of cases that we are seeing. We also, as time goes forward, if new cases arise and the question is asked and the answer is that we've gone to this or other outdoor location, that information will be updated. But one of the things that I want to take the opportunity to emphasize is that the concerns about some of these places of mixing aren't just off the top of your head concerns. There is scientific evidence, scientific literature that actually supports some of these, and I want to actually take the opportunity to quote a couple of these at this point in time. One of the most telling is one that gives us a nice phrase that is being quoted by the Journal of Alcoholism and Drug Abuse week for July 13th, 2020, and it speaks about something called alcohol myopia, when we are looking at the level of disinhibition that is demonstrated when people have, as they say, a few drinks in their head, that blood alcohol level rises, the general higher level functions and judgment tend to decrease commensurately, and people then behave in a manner where they don't actually pay attention to physical cues. They don't pay attention to how close people are to them. They don't pay attention to who's wearing a mask around them. Another quote from a professor of epidemiology at the University of Ohio gives us a nice mnemonic that I would like us to bear in mind at this point in time, saying that, again, alcohol consumption then works against some of the observation of factors that will help to reduce spread. The time that you spend in a given place. If we go out to drink, then we're actually spending a fair amount of time. We're not going for 15 minutes and leaving. Any interaction over 15 minutes is considered a significant interaction. Space, in terms of physical distancing, that spacing diminishes considerably as our inhibitions and our awareness of physical environment goes downward. People, the number of people we interact with in a crowded space, will increase our risk, and clearly these settings are settings that can promote crowding. Place, indoor locations that have recirculating air, and have people in high densities in close proximity, another high risk, so those indoor spaces. And face, it's basically impossible to eat or drink without a mask. So that time, space, people, place, and face mnemonic, all of those factors actually take a southward turn, move in the wrong direction when we have gathering with alcohol on board. And this is supported by journal evidence, by external experts, not stuff that we're making up. It's not stuff that we're saying off the top of our heads. And this information will actually be hosted with appropriate links on the Ministry of Health website for reference for those who actually are interested in reading further. So thank you for the question.
Thank you. And we go now to Newsday, please.
Good morning, everyone. Ryan Hamilton Davis, Trinidad Newsday. Two quick questions. First one for Dr. Hines. There seems to be, along with the slackening of wearing masks and stuff like that, there seems to be some confusion concerning wearing gloves. Apparently, some people are of the opinion that when you wear the gloves and so on, you could be exempted from hand sanitizing, hand washing, these kind of things. I'm pretty sure we went over this before, but if you could just re-advise the public on the use of wearing gloves. And the second question would go to Dr. Doon concerning diabetes. What would be the prevalence of diabetes in younger people? Most people, when they think of diabetes and so on, they would think that this is more for the elderly. So if you could point out if younger people are just as at risk as the elderly. Thank you.
Okay, thank you for that question. It's actually a very important one. I appreciate the opportunity to address this further. Glove wearing, the way it's currently practiced, tends to promote a feeling of false security. Now, having a glove on does not mean that you aren't transferring contaminants from one place to another. The gloves aren't inherently germicidal, meaning there's nothing in the glove that kills germs. So you take the glove, you touch something that's dirty, and then thinking that your hands are still clean, you move from touching one dirty thing to either picking up your food, which I've seen people do, touching your face, holding your phones with the gloves, opening people's doors with your gloves. All of these things actually promote risk and promote the spread of disease and germs, as opposed to following the hand sanitization recommendations. So hand sanitization, by all means, completely trumps glove wearing, and we actually discourage the use of gloves and encourage the use of frequent hand washing and use of hand sanitizer. And we would see sometimes that there are business places that tell you, please remove your gloves and sanitize your hands, and we endorse that. That is exactly what should be done. We do not encourage the use of gloves moving from one place to another, as really what happens is people forget that their gloves become dirty. They figure my hands are clean, and they move around touching things with what is essentially a dirty pair of gloves. So hand sanitization over glove wearing every day, any day, all day. I'll now turn it over to Dr. Doon.
Yes, well, I don't have any specific data in that band, but we do know from the reports from the hospitals and health centers that conduct these inquiry for us. There are increasing evidence that younger folks, that is in their teenage years, are getting diabetes. The data that we have starts at about age 20, when the prevalence is about 4% of the population at that age. So as you get older, by each changing decade, you start at 4% between 20 to 25 years of old. That's a prevalence. And it really starts to rise sharply at age 45. At age 45, it's about 10 to 15%, and then shoots way up to almost 40% as you get to your 70s. So it's a steep rise. It goes up gradually between 20 to 45, and then from 45 onwards, it rises steeply. But in the teenagers, just a handful of cases. But I don't have the specific data on that.
Thank you, Dr. Doon. And we move now to TV6, please.
Hi, good morning. Alicia Boucher from TV6 here. I just have the flip side of that question that was asked because I was wondering if, Dr. Hines, you said that it was mentioned that about 200,000 persons in this country have diabetes. And I wanted to find out, based on what you said, Dr. Hines, that persons with hypertension as well as persons with diabetes are the ones that we're seeing succumbing to the virus more than others. So I wanted to find out if we have figures for the elderly persons in particular who suffer from both diabetes and hypertension, so we can know just how much of the population is seriously at risk in that regard. And the next thing, the next question has to do, you mentioned that we were at a plateau, I think that was about 2 weeks ago. I wanted to know if we're still at that plateau, if we're seeing any more light at the end of the tunnel in terms of moving from community spread to localized spread. Thank you.
Okay, thank you for the questions. I don't have the exact prevalence of both hypertension and diabetes in older people as a mixture, but we do know that both of these particular conditions can coexist, tend to coexist, and coexist at higher rates, higher levels of prevalence in the older age groups. The older you are, the greater your likelihood of being either hypertensive or diabetic or both. What we also see is that in older age groups, looking at the age-specific case fatality rates for COVID-19 in particular, you start to see case fatality rates that are much higher than our general population CFR of 1.89%. And older age groups, the case fatality rate goes up to above 60, it's around 11%. Above 70, it's around 17%. So whatever the pre-existing or coexisting conditions are, age plus the increased prevalence of coexisting conditions does increase your risk of adverse outcomes quite significantly. I'm not sure if Dr. Doon has anything to add to the prevalence of diabetes and hypertension in the older age group.
Yeah, well, prevalence of diabetes by itself is 30% in the population, and diabetes is 22%. So, and I don't know that you have the specific number for these two conditions in this single individual, but I would hazard an estimate of at least 25 to 30% of the population would have these two conditions. As you grow older, it tends to rise to about 50%. Once you cross 65 years of age and onwards, about 50% of the population would have hypertension. It increases, and with diabetes, it's about 37 to 40%.
Thank you very much. Those are some very serious, probably startling figures to some of us.
Now, just to address the plateau, because that was the next question. Yes, at this point in time, we're still seeing basically a relatively steady level. We're looking at an average of high teens to low 20s in terms of numbers of new cases per day. In terms of the pattern of distribution, we are seeing a trend back to more of the positive cases being related to each other, i.e., that is, the cases are related or linked in some way and may be part of a cluster, but we are still seeing that some cases arise without any known exposures, and they just arise out of the community swabbing that continues to happen. So we can't say yet that we're back to cluster, but we can say that we're seeing larger proportions of the positives belonging to clusters, and that's a trend in the direction that we're hoping to move in, and we'll keep the population apprised as we get additional information.
Thank you. We have an additional question from CNC3 now, please.
Hi, thank you. I only asked one question then, so I will ask two now, right? The follow-up and the one from them. Okay, so Dr. Hines, I don't know if you'll be able to speak to this, but there seems to be a bit of miscommunication going on with regards to bringing pets into the country. The Ministry of Health is saying you have to check Ministry of Agriculture, and Ministry of Agriculture says you need to check Ministry of Health to get the permission to bring those animals in. So I don't know if you'll be able to speak to that. And my second question is to Pandit Sharma. Over Diwali, one of the more common things is sweets, and a lot of people, including myself, have asked people, bring some parasad for me after Diwali, but is there any risk of transmission of COVID-19 or anything that concerns you in this practice? Thank you.
Okay, thank you for your questions. The first one, actually, the answer is brief. The office of the CMO will be best pleased to respond to the question on which of the ministries is really lead on that. So I wouldn't presume to make a definitive statement without first verifying with the office of the CMO. And I'll turn you over to Mr. Sharma.
We go to Mr. Sharma now for follow-up.
Thank you for the question. Surely during Diwali, we have sharing of food and sweets especially. So far, the evidence does not support food as being a very strong vehicle for the transmission of the virus. However, in handling and utensils and food boxes and packages, there's a possibility that you can transmit the virus. So we have been asking that if when you do get involved in packaging sweets and food for distribution, you do the masking and hand sanitization, and that's a good start. So your packages would be clean and free of the virus, and indeed by using tongs and other kinds of spoons and so, and place it into the package, then we will again decrease the possibility of transmitting the virus.
Okay, thank you. Just want to add to that, basically just to reinforce the three things. First, the routine food hygiene precautions, all of the things that you would normally want to emphasize in making sure that food is safe for consumption, all of those apply. In addition, in the packaging and handling, as Mr. Sharma just rightly pointed out, we want to encourage people who are doing that to make sure to wear the mask. Not just think about it, actually make sure that you're wearing the mask, make sure that you sanitize your hands before handling the utensils, sanitize your hands before handling the packages, and in that way you reduce the risk greatly. You reduce the risk because of all of the combined benefits of all of the hygiene procedures in preparing and in sharing food.
Thank you very much. We have come to the end of today's media conference. Thank you to everyone who participated. Just to let you know that from next week, my colleague Al Alexander will moderate the conference as I will be on a brief hiatus. Thank you, everyone. It's been such a pleasure. And just to let you know, this weekend we recognize World Diabetes Day and we will engage in Diwali celebrations. We encourage everyone to celebrate Diwali safely. Celebrate with those in your household, please. As you go about with your preparations, please follow all of the new normal measures. Wear your mask, stay 6 feet away from others, hand sanitization, cough etiquette, all of that is very important. Please protect our elderly and those who are highest at risk, those